My name is Brian Baird. I am a clinical neuropsychologist by training, and I had the great honor of serving in the United States Congress for 12 years. Sadly, I came to the issue of oxygen and pulmonary fibrosis because my father died of it. Quite literally, he died in my arms. And ever since, I've dedicated myself to trying to help patients and researchers and healthcare providers address this disease. Today, what we're going to talk about is something that I hold very near and dear because, having served in the Congress, I know the importance of advocacy, and I want to talk to you all and give you the skills you'll need so you can become an effective advocate with your elected representatives. And just a brief note of why that matters. Some of the advocacy work we have done in the last number of years has actually increased funding for pulmonary fibrosis research by more than $100 million and has also substantially expedited the ability of pulmonary fibrosis patients to access Social Security disability and needed medicines. So, with that, let's talk a little bit about what advocacy is and how you can do it. One moment, we'll make sure the slides work. Okay, so why does your voice matter? First of all, members of Congress meet with lobbyists all the time, and advocates and constituents, etc. But I will tell you from experience, there is no more effective advocate than a person or a family member dealing with a critical disease. Your personal story, your personal experience is absolutely compelling to policymakers. And if they don't hear from you, then they don't know what your needs are. If they do know your needs, they can work on your behalf. So if you're a researcher, a treatment professional, a family member, or a patient, getting your message to the people you elect matters a great deal, and your stories can make a great difference. So why advocate? Well, if there's greater awareness of pulmonary fibrosis, and if many of you are like our family was, when my father was diagnosed, we had never heard of the illness. And here we were facing a life-threatening condition that we knew nothing at all about. That is true, I can tell you, for most members of Congress and state legislators. Unless they've had the disease in their family or by a close friend or staff member, they don't know anything about pulmonary fibrosis. So what do we need to do? We need to expand awareness for pulmonary fibrosis. We need to increase funding for research so we can develop cures and treatments and prevention. We need to improve patient care, and that includes things like access to medications and oxygen. And we need to tell policymakers that if you do this, you will save money ultimately on overall healthcare costs. But most importantly of all, we need to advocate so we can cure this terrible disease. So how are we going to go about doing it? There are 6 essentials of effective pulmonary fibrosis advocacy, and they're not super hard to understand. These are audience, information, telling your personal story, and ask, which is what you ask your policymaker to do, and then persistent follow-up. Let's take them one by one. First of all, your audience. First thing I want to say is it's not complicated. You can do this. Everybody has the right to reach out to your elected official and tell them your personal story and needs, and you can do it. First of all, who's your audience? Well, your audience can be members of the House, the Senate, or their staff. These are the people you've elected to represent you. Once you get to know who they are and how to reach out to them, they should be there for you. So who do you speak to? We'll talk today mostly about federal elected officials. You're members of the U.S. House of Representatives and the United States Senate. The reason we're going to focus on them primarily is because, frankly, that's where the money is. The National Institute of Health, the National Heart, Lung, and Blood Institute are the primary funders for basic research. Medicare and Medicaid are the primary funders for health services, doctor visits, hospitalization, oxygen supply, medicines for a great number of pulmonary fibrosis patients. So we advocate with our federal electeds and with federal agencies. We also sometimes reach out to state elected officials because they too need to know about this illness. So everyone asks me, how do I know who my elected representative is, and how do I reach out to them? Well, there are some easy resources. First of all, the Pulmonary Fibrosis Foundation has an advocacy link on their website. You can go to PFF at Pulmonary Fibrosis Foundation's website and go to Take Action, and you'll link to how to reach out to your representative. Another way that's very, very easy is shown on your screen, www.house.gov. This is the official site of the United States House of Representatives, and there you can find who your representative is. When you go on, as shown on this screen that you're looking at, there will be a space in the upper right that says enter your zip code. When you enter your zip code, it will take you to who your House member is. It is possible that your zip code is shared by two House members. You only have one who actually represents you, but sometimes congressional districts overlap zip codes. So it typically give you a choice of two people. Then you enter your actual street address, and you should go right to your representative and to their website, which is where you can contact them. So it's really a two-step process. Go to house.gov and enter your zip code and address. Then you'll be taken to your representative's website, and you go there and you can send them letters, you can find out their schedules, you can learn where they stand on issues, etc. If you want to talk to your senators, and a very brief primer on how Congress works, remember that every state has 2 U.S. senators, and that each state has House members determined by the size of the state. So everyone in your state has the same senators, so you don't really have to enter your zip code in your state. You just enter the name of your state, and you'll find the names of both of your senators. It's really that easy. Next, another resource, if you want, is a different website called govtrack.us. Works very much the same way. One of the nice things about GovTrack is it takes you to a map of your state and your congressional district, so you can see, oh, this is the district that I live in. But the main thing is reaching out to your representatives. Now, once you've reached out to them, how do you get in touch with them? There are a number of ways. One, you can directly visit their office. If you happen to be in Washington, D.C. or plan to visit, go there. But all members of the House and Senate have offices in the state and in your congressional district. So you can call your local office and say, I'd like to stop by and visit with the staff or with the member of Congress if they're in town. Now, one caution there is that sometimes local offices can be rather far away from where you live, especially in big western states like ours, where I live in Washington State, or some of the more rural areas like Montana. That could be a long way away. But most members of Congress do town hall meetings. Some will post on their website when they're doing a town hall meeting. And a town hall meeting is just basically the member of Congress, the House or Senator, comes to your area, has a public opportunity in libraries, fire halls, other places where people meet, and you could just go there and talk to them. And I want to talk to you about in a moment how important that is. A third option is to make phone calls. The numbers, sorry for the bump in the screen, the numbers for reaching your member of Congress will be listed on their website. You can just call them up, and generally you'll find a very positive, responsive person on the other end who will tell you or answer your questions and hopefully possibly take down your comments. You can also email them. The members' websites will almost always list the easy email. Now, understand that you can typically only email your own member of Congress. Don't try to blast emails to every member of Congress simultaneously, because the system won't allow it. The simple reason being that if that did happen, everyone would be besieged by emails all the time and not get anything done. Last but by no means least, you can do the old-fashioned thing of writing a letter and mailing it to them. Members of Congress get hundreds of letters every day, and they typically try to respond within a couple of weeks. So, those are the 5 ways. Now, something incredibly important I want to emphasize. If you want to have an impact with an elected official, meeting with them in person is literally thousands of times more effective than anything else. The reason for this is simple. Members of Congress get hundreds and hundreds of emails every week, sometimes in a single day. All of the people who write those emails are important, and all of their issues matter. But it is just humanly impossible to read hundreds of letters every day. Most of us try to read at least a few a day, personally, and then we have staff track things for us. But if you're at a town hall or in the member of Congress's office in Washington, D.C., or in your congressional district, and you can meet in person and tell them who you are, why your issue matters, and what you need them to do, you can build a relationship that will have such impact it's hard to imagine. So call your member of Congress's office and say, I'd like to meet directly with my member, Senator so-and-so or Representative so-and-so. When would I have an opportunity to do that? You'll hear something like, well, if you're going to be in D.C., we can schedule a visit in our D.C. office, or if you're in district, you can come by our district office, or the member of Congress is having a town hall. Now, when you meet with someone, be polite. That shouldn't seem hard, but be doggedly persistent. Your life is at stake, and the lives of your loved ones are at stake, and I can tell you, persistence pays off. Members of Congress get used to seeing certain people in their town halls or hearing from members of the public by email or in phone, and if you build a close working relationship, they will care about you and about your family, and they will try to help you in any way they can. Last but not least on this slide, don't feel disappointed or disrespected if they ask you to speak to staff instead of directly to the member of Congress. Remember, it is staff members who often give advice, study issues, make recommendations, and share information with the member of Congress. And they will often be your very, very best advocate in the member's office. And be patient. Members of Congress have incredibly busy schedules. They're tasked with 1,000 things at the time. They may have votes. They may have committee hearings, etc. And so when they offer for you to meet with the staff, accept that willingly and happily. Build a relationship with staff and stay in that relationship. Just as it's 1,000 times more effective to meet directly with the member than to just write an email, it's similarly that much more effective to meet with the staff member so they get to know you. Now, once you meet with them, what do you tell them? What are the facts and why do they matter? Basically, think of it this way. The member of Congress needs two things in order to act. They need information about what your concerns are, and then they need to be motivated. They need to care about you. So here are some basic facts. And by the way, if you give someone a vast array of information in Congress, it is often less helpful than if you just give them a one-page sheet of information, succinctly saying what the member of Congress needs to know and what you want them to do. So here are some facts that we at Pulmonary Fibrosis Foundation think every member of Congress should know. You can read them on the screen, but why do we pick these facts? Point number one, when we say 200,000 patients and 1 in 200 people over age 70 have IPF, we do that because remember, most members of Congress have never heard about this, and we put these large numbers out, they say, oh my goodness, I had no awareness that this was such a serious problem. When we talk about the increase in the number of deaths from pulmonary fibrosis in the last 10 years, we do that to not only say this is a prevalent problem that's common, but this is a lethal problem that is increasing. When we throw in the information about the annual costs, remember, members of Congress have to try to balance budgets, raise revenue, spend money wisely. We want them to know that not only does this cost us lives and quality of lives, it costs the taxpayer and the federal government and health insurance programs, all of us together, it costs a great deal of money. Now, we also want them to know the urgency of this. As many of you know, as I found out when my own father passed away, for some aspects of pulmonary fibrosis, for some patients, sadly, the time from diagnosis to a person's passing can be frightfully short. And so we want members of Congress to know this is prevalent, it is serious, it can be lethal, and it can be very rapid. And last but not least, we want them to appreciate the desperate sense we all have when we or our loved ones are diagnosed, that you can't just turn to your doctor and say, okay, I've got an illness, how are you going to cure it? Because as many of us know, we don't really have a cure for that. So we are going to make these slides available to you, by the way. through the PFF Patient Communication Center. Again, the Pulmonary Fibrosis Foundation's Patient Communication Center will have these slides so that when you call your member of Congress or visit with them, you can actually print these out and give them to them, or leave the message or include it in your email or your phone conversation. Next. By the way, we'll be giving an opportunity for, if you have any questions or comments you want me to address either during the slides or afterwards, feel free to text us or to chat us. Send me a chat. I can see them on my screen, and I'll make sure to address as many as we can before we finish today. So, how do you say this? Whether you have gotten the good fortune to meet with your member of Congress or to perhaps even attend a town hall. Here's a couple of important things. I mentioned be respectful first. Secondly, you want to make things fairly brief. All of us are busy, not just members of Congress, but all people these days. So you want to make things fairly concise. Share the facts quickly. Share what you ask them in the same sense of immediacy. And make what you give them, as a leave behind, as we call it, fairly concise. There are some things not to say. Don't threaten anybody, for heaven's sakes. Don't promise to give them a contribution if they do something for you. That's actually illegal for them or you, and you could both go to jail. So just basic rules of decorum, I think, apply here. And then finally, this is really important. If someone has done something you appreciate, let them know. Letters to them saying thanks, or to their staff. If a staff member has been helpful, commend the efforts of the staff member. And if you really appreciate what they do, write letters to the editor or post things on social media. Now, once you've conveyed the information of numbers of people affected by pulmonary fibrosis, the lack of a cure, the increasing frequency, all those things, tell your personal story, but tell it briefly. Why? Members of Congress get besieged by information, and they work awfully hard. But they, at heart, want to serve the people they represent, and they actually, believe it or not, really do care. There are exceptions, but most members of Congress are deeply thoughtful, caring, and compassionate people. And when someone sits in their office or talks to them on the phone or is at a town hall and says, "Congressman, I or my loved one has what could be a terminal disease, and we need your help," that touches the member of Congress. I can tell you personally how powerful patient stories are. You have to condense them. Tell a little bit about either yourself, if it's you who has the illness, or your loved one, how they got diagnosed, what the experience has been like, what it means for your family, and what you need. Do you need more research so that we can try to cure it? Is your oxygen supply inadequate? Do you need more access to Social Security or Medicare disability payments? Those kind of things can be very powerful. And then we have what we consider some specific asks. So here's a slide that can help guide you and or your loved ones as you prepare your personal story. I should also mention that if you have some connections to the member of Congress, for example, if you know where they went to school, or their staff, I should say, or you're from their same hometown, or you saw them somewhere, share those. It just helps, like in any small talk conversation, it helps build that relationship. So the ask. What is an ask? You've made the time to get to know the member of Congress, find out who they are and where they are, reach out to meet with them. You've shared the important information about the disease overall and about how it affects your family, and now you have to ask them to do something. What is it that you ask? In general, your asks often take the following form. If there's a particular piece of legislation you want them to co-sponsor, you say, "Congressman or Congresswoman, there's a House bill this or that, or Senate bill this or that," and you give them a number and a title and ask them to co-sponsor. That doesn't mean they voted for it yet, but it means they support this legislation in principle and they want it to come to the floor for a vote. Now, if I were you, I would be saying, okay, great. How do I know what legislation that is? Well, sign into the Pulmonary Fibrosis website, sign up for the informational briefings, and as legislation that is important to you, becomes available or becomes up on the House or the Senate floor, then you can look at that and say, aha, PFF is asking us to send a letter or an email or a call or visit our member of Congress to talk about House Bill, whatever it is. You'll have information about the bill's title, its number, who the sponsors are, and what the bill's contents are. So you can ask them to co-sponsor or co-sign a letter. Now, you can also, a smaller level ask is, if they don't want to co-sponsor something, people have legitimate reasons for that, you say, well, will you at least commit to reading and reviewing the material and giving it consideration? I remember vividly a woman who raised an issue at a town hall, gave me a package of information and asked me to read it. I promised to do so. As things happened, I got very busy with other tasks, didn't quite get around to it, to be honest, and there she was at the next town hall and said, Congressman, very politely, remember I gave you this literature to read. Did you get a chance to read it? Now in front of a bunch of people, I had to say, you know, I'm very sorry, but I didn't. She said, well, I brought more copies. Here they are. And she had a stack. This was a giant stack. We don't want to give that much. But she said, do you please read it this time? So guess what I read on the flight back to Washington, D.C. from that town hall? The next time I saw her, I knew what she had asked me to read, and I had done my homework, as it were. So you can ask for that. If somebody doesn't want to co-sponsor, at least will you study this issue? Will you keep pulmonary fibrosis in mind and our family in mind? And when the bill comes up, we hope you can support it. They're often, those are the essence of the chaos. Please learn about the disease. We often ask for increased funding for basic research. Now, a quick note about this. Pretty much everybody who comes to Congress asks for more money to be spent or to lower their taxes. So that's not a new ask. What we think is important is to explain to members of Congress that given how many people are affected by this disease, we believe federal funding is not adequate at the current levels. If 200,000 Americans have this disease and some 30 or 40,000 may die of it every year, and we have no known cure, it deserves more funding. Certainly if a terrorist organization were killing 40,000 Americans every year, we would act and we would spare no expense. So if a disease is doing the same, we need more research and more funding. We want to support Pulmonary Fibrosis Foundation's registry. The Pulmonary Fibrosis Foundation, as many of you know, has the leading registry for pulmonary fibrosis in the nation and I believe in the world. And if National Institute of Health or National Heart, Lung, and Blood Institute can support that more, it will help the PFF registry help more patients. And last but not least, there is currently a major push underway with PFF, Pulmonary Fibrosis Foundation, leading the way to try to make sure that oxygen supplies are improved for patients in need. Having dealt with this with my own father, I know some of the frustrations many of you experience. We understand that. We're trying to make changes in the Medicare rules and regulations and in the laws that guide those rules. And we have a comprehensive coalition working vigorously to do that. And we'll keep you posted on the PFF website and through emails. In fact, I think it's fairly likely that within the next month you may get, if you've signed up, and I hope you have, you may get some urgent bulletins from the foundation asking you to send letters precisely about your challenges facing getting oxygen to treat yourself or your loved one. So keep that in mind and be ready for it. Now, once you've done all this, and you've met with your member of Congress or their staff, and you've shared the information with them, and you've asked them to take action, you don't just stop there. Remember the story I told. The woman who gave me that information to read didn't just give it to me and forget about it. There she was at the next town hall. And in front of everyone, there she was asking me had I read it. And guess what? Who do you think I saw when I did the next town hall in that same city? The same lady, the same issue, making sure I was staying on it. As it turned out, I didn't actually agree with her position, but I surely appreciated her passion and her interest and her courtesy, frankly. So whatever you're working on, you must follow up. If you've asked for someone to sign on to a bill and you've spoken to a staff member saying, would Congresswoman so-and-so please sign on to the bill? Call that staff member up again in a few weeks and say, did the Congresswoman get a chance to read the information and has she agreed to sign up for the bill? So it's persistence and it's follow-up. If you're polite and you use valuable information and you're respectful, people will care about you. So you contact people again and again and again. Now, one of our goals at the Pulmonary Fibrosis Foundation is this, that at least once, and hopefully many times, every single representative is contacted by someone from the broader pulmonary fibrosis community every single year. We want every member of Congress to know about how terrible this disease is, how lethal it is, how widespread it is, and how desperately we need research and a cure for this disease. So you can make it a personal goal. You can work with your support group to say, we want everyone in the Congress, all members, 435 members of the House plus the 4 delegates, every United States senator to know what pulmonary fibrosis is, how much we need their support in improving research, etc. If they've taken action, be sure to thank them. Publicize your support and appreciation. And if they won't support, you publicly ask why and make it personal. Those are the key elements of advocacy. A couple other elements. You can amplify your voice. If it's just you, that's important, but if more people say the same message or read the message, it's that much stronger. So let's look at how you amplify it. One way to amplify it is to encourage others to advocate through a support group, through your friends or family, through your social media, through your online work, through your emails, your colleagues, your coworkers. The more information a member of Congress hears, the more impact it has. You can also write letters to the editor. Send letters to the editor, especially if the member of Congress has done something good, or sadly, if you feel that they've disrespected you or disregarded your issue, then you can write to them and say, write to the editor and say, we're not happy about this. Sorry, I'm just checking a time thing here. Okay, we're still good. Social media. You can tweet about this, put things on Facebook or other social media platforms. And then you have earned media. Earned media means things we do to get the general press to cover our issues. So if you've got a benefit walk for pulmonary fibrosis, if there's a significant person in your community who's dealing with fibrosis, anything that raises the profile and is of some human interest that your local television, radio, newspaper, or other media might want to cover, that amplifies your voice. You can also let people like educators and colleges and universities and high schools know about this. And if you happen to have some prominent philanthropists in your area, reaching out to them is also a good idea. Now, political engagement. What do I mean? What's the difference between political engagement and advocacy? Advocacy is when you talk to someone who is already elected or possibly who's running for office, and you share information with them for the sake of influencing public policy. But ultimately, we are only going to be able to influence policy if we get capable, well-motivated, and caring individuals elected to office. So how do you do that? Getting engaged in the political process is another way of expanding the influence you will have on pulmonary fibrosis. If I was just yesterday, as a matter of fact, doing what we call honk and wave, where we wave signs and wave at traffic goes by, and we drop literature and we make phone calls. If you're volunteering on a political race and someone is fortunate enough to get elected thanks to your help, obviously you should probably have a connection with them owing to the relationship you built in the process. So you can volunteer on campaigns. You can write letters to the editor. You can go to campaign events. If you can afford to do so, contributing to someone. But, you don't just necessarily write a check. When you put the check in the envelope, say, this is to help you get elected, and when you do, I certainly hope you will care about patients like me or my loved one who has pulmonary fibrosis. You're not buying a vote. You're not buying influence, but you're letting them know, I support you, and I hope you'll care about this thing that matters so much to me. The same is true of reaching out on social media to help someone get elected. And I should say this. On relatively rare occasions, we come across patients who attempted to advocate with a member of Congress or their staff and were treated disrespectfully, dismissed, or were treated rudely. Some members of Congress have said, I'm very sorry you're sick, but don't ask us for any more money because there simply isn't any. Others have summarily dismissed our request for co-sponsorship of legislation by saying they won't do that, or other ways. That's not how it should be. Even if someone doesn't want to do exactly what you ask, they can show compassion and concern, treat you with respect, and try as well as they can to be responsive. If they're not, thankfully in a democracy, you can help remove them from office and elect someone who will care and will be responsive. So we want to support the people who support our issues, and if someone disregards our issues, you have every reason and responsibility in some ways to try to engage in the political process to change that. So that's how you do it. The next question is, will you do it? And will your friends and family members do it as well? Research has shown us this, that if people write down a commitment to take a certain action, they're more likely to do it. So I'm going to take just a second and ask anybody who's watching this to do the following. Take out a pencil and paper, or if you keep notes on your computer, on a task list, or on your smartphone, any device, and write down what specific action are you going to take in the next 2 days, because as we delay, things go farther. To reach out to at least one elected official, I would recommend a U.S. House representative or senator, and contact them regarding pulmonary fibrosis. Ideally, ask them if they'll be in your area for a town hall, or if there's another way you can meet them. But write down what action you're going to do. Maybe it's call their office. That's the easiest, and it's important to do. Maybe it's call their office and tell them you want the member of Congress to be paying attention to pulmonary fibrosis and to help out to improve the supply of oxygen, and let them know that there are efforts now to do that. Set a firm date by which you'll do it, and ask others to do it. Enlist some partners. I want you each to do that now, and then drop us a note at Pulmonary Fibrosis Foundation and let us know what you've done so we can share your story of effective action. Now a quick success story, and I alluded to this at the start. My dear friend Paul Fogelberg, who I think is watching this webinar today, is a patient who has had pulmonary fibrosis for several years now. When I was in the Congress and Paul learned that my father had died of this illness, he let me know that he suffers from it and that he is trying to put together an advocacy organization. Paul and I worked together, and we worked along with the Pulmonary Fibrosis Foundation, who's hosting this webinar now, and jointly our efforts led to, as I mentioned at the start, a collective increase of more than $100 million in pulmonary fibrosis funding. We were together able to add pulmonary fibrosis into lists of diseases that could be studied under special research programs. We were able to expedite the process by which pulmonary fibrosis patients qualify for Social Security disability payments. We supported increased processing of approval applications for medicine, and now we're working keenly on the oxygen issue. Building relationship with members of Congress, telling them your story, giving them information that is useful and accurate, and making reasonable asks for their support can and will have an impact. The more of us who do it, the greater the impact. The more often we do it, the stronger our voice. The more closely we build our relationships with our electeds, the more likely they are to help us. And I should note, last but not least, we are not far from an election. Many people right now are in office, are trying to get reelected, and they'll be coming home to their districts. They may be holding town halls. They may be hosting campaign rallies. There's your opportunity. It doesn't matter if you're a Democrat or Republican or independent. You have every right to approach any candidate or any holder of public office, tell them your story, and ask for support. For goodness sakes, you're facing a terrible disease with courage and dignity and determination. You can be fearless in trying to reach out to elected officials to ask them for your help. So, I'm open now to any questions, any comments. We could practice. You could send me a chat, and I'm happy to help. If you need further information, of course, to just reiterate, the Patient Communication Center at the Pulmonary Fibrosis Foundation and their website are a fantastic resource. And I see some people are typing. Let me see. We'll see what they have to say. One person writes to me that he has meetings scheduled already with both U.S. senators and his U.S. representative next week. There's someone taking action. He's already scheduled that for next week. And imagine if everybody all across the country, members of Congress, candidates for office, were hearing from the same. My dear friend who I know, Cindy Chandler, whose family has been terribly affected by this, is sending me a note and saying hello. There are others typing, so I'm waiting for my chats to pop up. Okay, so there's a question right now. They need specific action as to what action we need from Congress and where funds are needed. Great question. Here's what I would recommend you do. Write to your member of Congress. So right now, partly because of where we're at in the congressional schedule and with the elections, there is no specific pulmonary fibrosis piece of legislation moving. But Congress is in the process, and the administration are in the process of preparing the budget for next year, and they're also looking at the appropriations, which are the spending bills for this year. So here's what you can do. Write to your member of Congress and say, this is who I am, this is where I live, I have pulmonary fibrosis, or my loved one has pulmonary fibrosis. It's a disease that progressively scars the lungs and is often fatal in a relatively short time. We urgently need your support, and here's our ask. Will you write to the National Institute of Health or the National Heart, Lung, Blood Institute, NHLBI, and urge them to increase financial support for basic and applied research for pulmonary fibrosis? That's the ask. Mr. or Ms. Member of Congress, will you write to NIH and urge them to increase support for pulmonary fibrosis? Also, if spending bills come up to support the National Institute of Health and the NHLBI, will you support increased research funding for pulmonary fibrosis in those? Secondly, as I mentioned earlier, and I'll say again, if you're having issues with oxygen, maybe the supply is unreliable, the cost is prohibitive, you don't get the kind of oxygen you need to maintain activities of daily living, write a letter to your member of Congress and to the Center for Medicare and Medicaid Services and saying, dear sir or madam, I'm a pulmonary fibrosis patient. To survive and have any quality of life, I need supplemental oxygen. My problem is that I fill in the blank what your problem is. Please do whatever you can to improve the quality, the accessibility of oxygen supply for pulmonary fibrosis patients and others suffering from advanced lung disease. Those two asks right away are sufficient. And if they do that and get back to you, thank them for it. If you're at a town hall or they're holding a town hall, the single most important thing you can do is go to the town hall or to their office, their district office, and get to know them. You don't always have to have a specific ask. Just get to know them, tell them about the disease, ask them to keep you in mind, and if anything comes up, be sure to keep me in mind and support additional funding, additional resources for pulmonary fibrosis patients. So we're asked about, another gentleman types in, hang on just a sec. Oh, one other thing that's really important on this, ask your treatment providers to do the same. Remember I talked earlier about amplifying your voice. If you're near a university where they conduct research on pulmonary fibrosis, tell the researchers they need to be writing their member of Congress. If you're pulmonologist or respiratory therapist, if you have relationships with them, which I'm sure you do, ask them to talk to their elected representative as well. Share the information. Just bring it in. I mean, once you've found out who your senators are or who your House members are, take a little sheet with them and say, here's a letter I wrote. Can you write the same thing? Dear Representative so-and-so, I'm Dr. so-and-so, or I'm nurse practitioner so-and-so, or whatever. Here's what I do. Here's why we need your support. Also, a couple other things. How do you get the copy of the presentation? Some nice comments about appreciating it. Again, the Pulmonary Fibrosis Foundation, this organization's website, will have that resource available, and you can also call the line that's listed on this final slide I have up. There is also, I should mention, for some of you who happen to be in the Washington, D.C. area, There is actually a rally for medical research in Washington, D.C. on September 12th and 13th. If you want to go and be part of a march and visit your elected representatives while you're in town, that can be very helpful. It's often, sadly, prohibitive for PF patients to do such travel, but if you're able to, by all means, do it. I also want to reiterate this oxygen issue. Pulmonary Fibrosis Foundation is collecting stories and information about the challenges people face. If you want, you can drop a note to Pulmonary Fibrosis Foundation telling your story. Try to be somewhat specific. For example, I've been on oxygen at this flow, at this volume. Here's what I've experienced. Either maybe the flow's perfect. Maybe everything's great. If so, tell us that. If it's not, what are the specific problems? Do you have problems with the equipment malfunctioning? Did you get adequate training? Do you get sufficient flow of oxygen to allow you to engage in the skills of daily living, work, visit with families, recreation, etc.? If you're not getting those things, please let us know, and we will be a conduit to the Center for Medicare and Medicaid Services and to congressional champions who we have, including Senator Chris Coons and Representative Eric Paulson, just to name a few, who have been just fantastic champions for us. If anyone else has other comments or questions, please send them to us. We'll wait a few more minutes in case some are coming in. The other thing, I haven't mentioned, but I should. Pulmonary Fibrosis Foundation is a nonprofit organization, and they did not ask me to make this request, and they may edit it out in future versions, but they need resources to function. They need resources to help fund the staff members who put together these programs. I'm not part of the formal staff of Pulmonary Fibrosis Foundation, but they have people who work with medical researchers. They have people who advocate with Congress. They have people who prepare information materials for patients. And if you have the resources to contribute to Pulmonary Fibrosis Foundation, to support their vital work, the registry that they fund, and so many other services they provide, please do so. They're a tremendously valuable organization, top-flight leadership and staff, and I know them all well, and it's a pleasure to work with them. So if you have a chance to do that, please do so. I'm not seeing any other chat comments right now. I should apologize that we didn't open this for auditory input, because with large numbers of people sitting in webinars, it becomes rather chaotic. But if you have further questions, please drop a note to the Pulmonary Fibrosis Foundation, send me a note personally, and I'll be happy to get back in touch with you. So with that, hearing no other chat questions, I want to thank all of you for participating. I wish you most positive support in your initiatives to advocate. It will make a difference. You can do it. Members of Congress, by and large, will be responsive, and together, eventually, we're going to put together the package that cures this disease and saves lives. Thanks for the opportunity to join you. I hope to see you again, perhaps at a summit meeting or elsewhere, and I wish you and your family the very, very best.